Chapter 6, Video 2. Now we're going to talk about what is normal versus what is abnormal and what defines an arrhythmia. When you ask yourself those questions that we just recently went over, you have to be able to apply those questions. So if you're not sure what is considered to be normal, you'll be confused. So we're going to start with defining normal. This is the criteria for a normal sinus rhythm. Sinus rhythm is the normal rhythm, okay? It has a narrow Qrs complex and they're all uniform in shape. They're regularly spaced Qrs complexes. The heart rate is between 60 and 100. The P waves are upright and rounded. They are married to the QRS, and what we mean by married to the QRS is you have a P wave followed by a QRS complex. That means they go hand in hand. When that atrium contracts, then those ventricles contract. You see those, the QRS follows that P wave. We have a PR interval of 0.12 seconds to 0.20 seconds. They're constant from beat to beat, and the QRS intervals are less than 0.12 seconds. The normal pacemaker of the heart is the sinus node. The sinus rhythm is a normal rhythm that originates from that sinus node. A rhythm originating in the sinus node should have a P wave with the QRS following. So this is the criteria for normal. If anything is outside of this criteria, then it's not normal. So when you ask yourself those 5 questions, we're trying to apply whether it is normal or abnormal. And then if it's abnormal, we're going to break it down and see where the abnormality is actually at. We're going to talk about an arrhythmia now. This is the criteria that defines an arrhythmia. The abnormal heart rhythm will have a combination of some of the following. You may have absent or abnormally shaped QRS complexes. You may have P waves that are absent. They may be multiple in number. They may be abnormal in shape. Your PR interval could be prolonged. It could be long or it could be short. You could have a prolonged QRS interval. The heart rate may be slow or it may be fast. It may be irregular and interrupted by premature beats or pauses. When we think about an arrhythmia and we think about whether these rates are slow or fast or whether they're interrupted or what the QRS complex looks like or what the P wave looks like, there's things that you guys need to remember. Remember that normal QRS complexes should be less than 0.12 seconds. And we went over this in one of the previous chapters. And arrhythmias are considered abnormal heart rhythms. Tachycardia is considered a heart rate greater than 100, where bradycardia is considered less than 60, having a heart rate less than 60. And normal heart rhythms should have P waves that are upright matching and precede the QRS complex. When a patient has a rhythm change, you should assess your patient first. So if you're looking at this EKG strip and you notice a change, always go check your patient first. Don't just assume that this patient is in a lethal rhythm. It could be something happened. It could be a technical error. So always be sure to go and check your patient. We're going to, this is something for you to pay attention to, characteristics for you to note, but we're going to go over and work on some practice strips, and I'm going to help you diagnose these. So for practice strip number 1, remember, we have to ask ourselves those 5 questions. So question number 1, is there QRS complexes? So the answer here is yes. So now we're going to look at their shape. They are all shaped the same in each lead. So now let's ask ourselves regularity. The rhythm that we're looking at is regular, as evidenced by the RR intervals all matching. There's 18 small blocks between. Now we're going to look at the heart rate. Because the rhythm is regular, we choose any two successive QRS complexes, and then we calculate the little box divided into 1500, which would be 18 divided into 1500, which would give us a heart rate of 83. Now we're going to look at the P waves. They are upright and matching. They precede the QRS. They are married to the P wave. The P waves are followed by the QRS. The PP intervals are regularly spaced. And now we're going to look at the PR interval. It is 0.12 seconds, which is normal and constant from beat to beat. And then we're going to look at that QRS interval. The QRS interval is 0.08 seconds. It's a normal beat. Okay? So everything here is looking normal. So on the next strip, we're going to go through the same series of questions and write everything down. We do have QRS complexes. All but one of the, oh, I'm sorry, let me get on the right strip. I apologize. Okay, let's start over. There are QRS complexes. Okay, so the answer here is yes. They're all shaped the same except for this one. We do have one that is not shaped the same. So when we look down, this rhythm is regular, okay? So we've got to determine regularity. It is regular, but it's interrupted here by a premature beat. The RR intervals are 21 to 21 and a half, and then it's 13 on the premature beat. So then we're going to look at our heart rate. 1500 divided by 21, remember, because we're going through the normal RRs. So our heart rate would be 71. We got 21 because we counted 21 blocks between the R and the R. We divided that into 1500 and got 71. The P waves here are upright. They do match. They precede the QRS. That fifth QRS, we noticed, does not have a P wave to follow. Before it. But elsewhere, the P waves are upright and match. The PP interval is constant, except for where there's a premature beat. Everywhere else, the PR interval is 0.12 seconds. It's constant from beat to beat, except where we have the premature beat. And the QRS interval is normal on all the beats at 0.06, but on that premature beat, we notice that it's wider. But everywhere else, it's normal. So this is a regular rhythm, but it's interrupted by a premature beat. So this is an example of how we will work through our strips. If you have any questions, please let me know.